All it takes is one class in college to create a lot of stress, and most of us are taking 5, 6, or even more. With these obligations, UNT wants to raise awareness to students of programs available to help them deal with health-related concerns at the Student Health Center right here on campus.
I think probably the top problem is, or the top diagnosis that the physician staff usually deals with in students are upper respiratory problems, colds, flus, allergies, things of that nature. And we also have a personal fitness trainer for those that want to put together some type of a workout regimen and also want to learn the proper way to use weights. They can come in and be seen by our registered certified personal fitness trainer. But there's just a wide variety of problems that the physicians and the nurses and the rest of the health professionals here deal with. So I don't think we can limit to just any one problem. We have a full-service pharmacy. In fact, in our pharmacy, we offer over-the-counter medications at a greatly discounted price. One of the new offerings we have this summer, or just in time for summer, is that of suntan lotion. You can come in and get a bottle of suntan lotion. And I'm sure a lot of our students will be interested in that during the summertime. I know we seem to have a lot of students that come in and have the sunburn, and also maybe they can come in and protect themselves by purchasing a little bit of preventive medicine, getting some suntan lotion. We also have a laboratory available, X-ray that is on site. I think we have some very competitive prices here. As you know, each student pays during the long semesters of fall and spring $25 per semester. During the summer, it's $12.50 per semester. And that entitles them to be seen by a physician or a nurse at no cost. So that means as many times they want to during the course of the year that they are enrolled, they can come in and be seen at no cost just to be assessed by a physician or a nurse. Now, there are charges for our ancillary services, such as pharmacy, if you need to get a prescription filled. And the price of getting a prescription filled here depends on what the medication is. In most cases, it will be probably a third of what you would pay outside the university at a commercial pharmacy. Our lab, the price is also greatly discounted, as well as our X-ray. And in order to see one of our psychiatrists or our allergists, it's probably about, probably about half of what you would have to pay on the outside to be seen by a private psychiatrist or an allergist, and sometimes even cheaper than that.
Not only does the health center understand the problems we might face while dealing with our physical health and stress, they also know how hard it is to kick a habit in the butt.
People come from the community, from the Denton community, and from the surrounding areas, as well as from UNT, to be part of this clinic, in which they get together for about 30 to 45 minutes with the doctoral student in psychology, in biobehavioral medicine. These clinics all are with the support of the psychology department from UNT. And in these clinics, they talk about some of the issues surrounding tobacco use, and for instance, what are the stressful situations they are going through, why the behavior of using tobacco takes place, what are some of the underlying psychological and social issues that perhaps are inducing the person to use tobacco. And they also talk about what are some of the behavioral aspects that can be modified in order to successfully quit tobacco use.
Well, we have the usual and traditional equipment that you might find in a doctor's office. Also, we have equipment to monitor lung functioning. Also, for people that are asthmatics, they occasionally will need a breathing treatment. We have that type of equipment. We have an EKG machine and a lung function test. Other than that, most of our services here as far as medical care are often just medical assessment and evaluation, and the equipment might just vary based on the individual needs.
When I first arrived here, one of the questions that were posed of me many times is, what do I do when the health center is closed? Where do I go? Where do I turn to? Well, in response to that, I've negotiated with Denton Community Hospital, which is very close to the university, within a few miles and all, and they have allowed us or given us a number that students can call after hours and talk to a nurse in the emergency room at Denton Community Hospital. And from that, they can find out whether this is something that can wait until the health center opens the next day, or whether it's something that possibly needs to be treated immediately, and we tell them to come in immediately to be seen.
Whether you're dealing with exams, work, or long commutes, the UNT Student Health Center has the proper remedy. And if you want to reach them by phone, they are available at 565-2787 or 565-4196. Adam Campetti, NTTV 22.